My name is Johan Karme. I'm a pediatrician from the Karolinska University Children's Hospital in Stockholm, Sweden. I'm the Swedish participant in the Young Physician Leader Program under the Iamp. I've had the opportunity to be attending a very good program together with 20 other young physician leaders from 16 countries all over the world in order to improve my skills and strength being a leader, and then attending the World Health Summit in Berlin.
This is a session for the Young Physicians Leaders Program, and the idea is to see what has been the impact of this particular program on the people who have been part of the program and those who have been alumni.
We're going to have 3 groups presenting to us and then discussing issues that are relevant to the young physicians globally and issues that affect the participation of young physicians in science, in research, and generally in healthcare services globally.
You have smartphones, you have computers, you can always be reached, and there is always a demand, more or less open, from your inferiors, from the patients, from your superiors, to be available. Our group on this morning's presentations, we were giving an example of how to balance life, because the challenges of being a young physician leader, it's difficult when it comes to combining the clinical work, the research, the proper leadership responsibility with the economy and so forth, the contact with the politicians. Then again, having a social life, being a father for myself or husband, and have time to work out and stay in shape. I mean, those are big challenges, and I think they're growing. And unfortunately, our group was concerned about that this is an impediment for younger colleagues wanting to take on leadership because the price is considered too high. So the discussion was how to help out, how to get more people involved in leading. And the findings actually is that we shouldn't underestimate our roles and role models. We are actually in charge of changing things. And very much as it comes to research, challenging the system and putting out questions is a very, very important feature that we should do even in leadership. Question what is going on, try to change it.
My name is Kopano Mabaso. I'm a South African health policy and systems researcher, and I'm currently doing a DPhil at the University of Oxford. I think often as young people we've got lots of energy, lots of ideas, but it can be quite easy to sort of jump from one project to another. The problems in the world are quite vast and big, and you can feel quite overwhelmed. So recognizing that you can't do everything yourself and that you do need sort of leadership and mentoring and guidance. So that's definitely something that I would like to improve on going forward. Our group spoke on how we can be part of the solution. So it's easy for all of us to identify the things that are wrong with the world, but what can we do in our own corners of the world to change things? And we really do believe that it is possible for each of us to make a difference. So we really wanted to push the YPLs to think about actual steps that they can do when they go back home in their communities to make a difference.
My name is Pál Maurovics Horváth. I'm a cardiologist from Hungary, from the Semmelweis University. My group was presenting regarding how to make research attractive for young physicians. As we know, we face a problem globally that less and less young doctors are willing to engage in research due to obvious reasons. It's overload in terms of work, studies, and lack of funding, lack of protected research time. So we believe that we have to make research already attractive in a very early stage, already in medical schools and also in high schools. So we have to invest in youth because we concluded that actually investing youth is the solution for future health problems. And these kind of events, big meetings like that, we should invite young doctors, even high school students, to get exposed and get inspired.